every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
From everyday meals to special treats, the very foods we love can sometimes trigger dangerous immune responses. But why does the body mistake harmless foods like peanuts, shellfish, or milk for threats? What causes that itchy rash, swollen lips, or even life-threatening breathing issues? We'll explore the causes, symptoms, and diagnosis of food allergies, and most importantly, how to manage and prevent them. Whether it's recognizing the signs or understanding treatments like immunotherapy, we've got the information you need to stay safe and informed. Today on your favorite health TV talk show, The Physicians, we'll be talking about food allergies, the causes, the symptoms, management, and of course, the prevention. We'll be right back after this time out. Do stay tuned. Today on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course, I'm never alone on this program. I'm with my co-anchor, the amiable and beautiful, and no other person than the...
My name is Dr. Martina Agberian. Welcome to The Physicians, where your health is our business and will always remain our
business.
Yeah.
Food allergies. I know you have enough stories for days. Let's hear them.
I have a lot of stories to tell of food allergies, so I'll just take only one.
Okay.
It had to do with my son. We traveled, went on vacation, and of course, as mothers, doctors traveling, we take a lot of things, medication, prednisone,
like first aid, yeah.
First aiders. And my niece was doing her birthday. The next day I heard of, Mom, look at what happened. His whole body, urticaria, hives, and what happened? I took what did you take? We narrowed it down to Smarties. So I asked, so you write the Smarties. Of course, I gave him the prednisone then, and the whole thing just subsided. Some years after, he was in secondary school. I was working in the clinic, waiting for my driver to pick me. The driver came with my son. His mouth was open. He was breathing.
Same Smarties again.
I had no idea what happened.
So that means it's an adult night.
Yes,
no Smarties for him.
Next thing, he couldn't breathe. His whole tongue was swollen. The lip was swollen one side. What did you do? Someone had a birthday. What did you eat? Food?
Cake.
No.
Cake.
No. So I said, yes. I said, you ran to Smarties. I ran to the teaching hospital. They gave him the injections, and that was how it subsided. So till date, anything smart. I said, if you know you want to take Smarties, put the tablets.
Exactly. So that you know that there's a
prevention. If you must take it, he said, why would I do that? So till date, he's an adult. He doesn't even wear Smarties.
Well, the good thing I like about this topic is that we have an expert in the studio who is here to school us about, food allergies generally and what we need to do and we need to prevent. And it's always a good thing when you know what you are allergic to. We'll be right back after this time out. Do stay tuned.
Every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. It's time for you to meet our awesome guest, and she's no other person than the beautiful Dr. Ifeoma Ezeoma. She's a consultant pediatric gastroenterologist. I think you should need to Google that for you to know the grace and the power she brings on board. Dr. Ezeoma, you are welcome. Of course, with the Lagos University Teaching Hospital, LUTH, which is, of course, Akokite, we shout that great Akokite as the number 10. Always looking radiant.
Thank you very much. Always happy to be here with you. Yeah.
Awesome. We are talking about food allergies today. So I want you to first let us know what causes food allergies in the first place. Because we need to hit the nail, boom, boom. Because if you say, okay, well, you can start with what food allergies generally are, but what causes it in the first place.
Okay, I think I'll define what food allergy is.
Yeah.
So we should be able to understand what food allergy is, then we'll now get to the causes. So now, food allergy is just an immune response to food that is being taken. There's usually protein in the food. So the body sees those food, which are the proteins in the food, which are normally harmless, they're not harmful, as harmful objects or as allergen. And now the immune system in the body starts reacting, start producing a lot of things, start producing histamine, and this causes the reaction. And the reactions are mainly could be mild to moderate to even life-threatening or severe types. So now, what are the causes? There are a lot of things that can cause allergy. We are dealing with food allergies, so there's some specific food that is most commonly linked to food allergy, like Dr. Martina talked about his son, like chocolate, some of the things, preservative in the chocolate can also cause food allergy. But most commonly, we see milk allergy from the things in the milk, the proteins in the milk. We also have the fish, like some people don't take seafood at all. They don't even eat it at all. Okay, you can see egg, you have people that react to egg a lot. Egg allergy, soy, wheat, you know. So these are the things that most commonly cause allergy. Yeah.
So is food allergy genetic? Can parents pass it on to their children?
Yes, that comes to the risk factors. There are a lot of things that can, the risk factors, genetic predisposition is also very, very important. It contributes to food allergy. Environmental factors can also lead to food allergy because sometimes we take in a lot of things that are allergen and will, cause the immune system to react. Then also, it also runs in the family. So, so also there are a lot of things that, these are the major things that age predilections too. Like the younger ones are more at risk of having food allergy, especially the infants and the toddlers. They are more common, allergies are commoner in that age group. Then also the sex predilections, the male are also more at risk, especially at the younger age. But once they get older, the women are more at risk because of puberty and because of hormones. So these are the risk factors, the things that can put one at risk of having allergy.
Okay, putting one at risk, that also means that it can be life-threatening also, right? So how does one recognize the symptoms?
Okay. Just like we said, it could be mild, it could be moderate, it could be severe and life-threatening. So it comes, sometimes it comes like hives, rashes, you see the body swelling, you have rashes, the mouth, the tongue swelling. Also, it can make you to start sneezing, coughing. Then the life-threatening one can have difficulty in breathing. And anaphylactic, reactions like having shock. The person,
that bad?
Yes, it's really bad. Go unconscious, go into coma. So these are the presentation because of severe vasodilation that usually comes with that.
This is quite disturbing because it just tells us that you have to be careful about what you eat and be your own watch to know if what you take, if it's going to, because for us in my house, right, we didn't know, we were not having any issue with intolerance. But my little 4-year-old son, anytime they give him, because the common thing when children are going to school is either cereal in the morning, bread and tea and egg or something like that. He was refusing tea and we're wondering what the issue is. He will cry, he will roll, he will hold his body. Then I had to put in my doctor's cap. I'm like, this boy is intolerant, or maybe he has lactose intolerance. And so I just immediately just said, let me just watch it, let me switch. And so we started giving him almond milk and all that. And we realized that that disappeared. From 4-year-old, he realized, he was able to sense that I'm not. So if you are bringing ice cream, anything now, chocolate, things that will not, if you like, eat in front of his younger brother, that one wants to do as if I can eat everything. He said, he told him once, he said, if you like, put your head down, raise your leg up, I'm not eating it because I know the effect it has on me. And that takes me to my next question. How do you distinguish between food allergies and tolerance?
Yes, so food allergy has to do with immune response reaction. The immune system is involved in food allergies, and you have all those presentations. But intolerance means that the body is not able to digest the food. So that's the difference. So it's not, they are not the same thing. So intolerance, you cannot tolerate it, the body cannot digest it, and it does not always require immune system, the body's immune reaction, to that. So that is the big difference. So you have lactose intolerance, you have those that have gluten intolerance. So these are two different things.
Okay, so I want to ask something. We're talking about food allergies, right? And is there any link with people that have other allergies? For instance, asthmatic patients or individuals. Is there any link that the fact that you have
food allergies,
you are prone to also having this, or like the case of the chicken and the egg? I want to just know.
That's a very, very good question. Very important. But most of the time, there's usually a link. Some of those that have allergy can come in different forms. It can come in form of asthma, like you see the respiratory tract, being congested during asthmatic attack. It can come as a skin. So most of them, those that have ectopy, commonly have food allergy, but not all the time. Our body makeup are different, so it's not everything that happens in this person happens to another person. So yes.
So do food allergies, generally, the way we see them, do they have anything to do with the way food are being processed, or how early introduce food to a child?
Yes, it's very important. That's why we have it commonly in infants, because then, from when you start your complementary feeds, that is when you start introducing new things that the child's body is not used to. So the body, first of all, the body sees it as a foreign body of, that they need to start fighting or either tolerating it. And that's what we're going to talk about immunotherapy later. So that is why it's common at that age. And after first decades, most of the time, you outgrow the food allergy, because the body is now used to that, so it's not more anything different. It's not like every time you beat a child, it gets to a point that the child will not even feel anything again. So that is the way our body is. So that's why at that younger age, it's commoner at that age, at infancy and toddler. Yes, that's where you have the highest percentage of that.
Okay, so is it possible for an adult to just present with food allergies?
Yes, we have adult onset presentation.
You've
never had it before. You just notice that at this age, that I'm reacting to this, I'm reacting to that. So yes, you can, but it's not common. Most of the time, it's younger children. Then adulthood is rare, but there's adult onset. Even adult onset asthmatic attack.
Yeah, you are very right, because I've had the case of them.
So we know that, for instance, sorry, I'm taking you out. For instance, for some children that have allergy, let's say for asthma, some of them actually outgrow.
Yes,
right?
they do outgrow.
Yeah.
In cases of food allergies, does it still apply in some cases?
Yes, most of the time they outgrow it. They usually outgrow it. The adult onset is just like, is not really more prevalent than the younger ones. Yes.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from Pharma. Darvite, love yourself.
Welcome back. This is your favorite Health TV talk show, The Physicians, where your health is our business. This is a great time for you to inform your neighbors and loved ones that The Physicians is currently on board. And this is the only place you get the best information from the experts that you don't get to see on a day-to-day basis. With us in the studio is Dr. Ifeoma, Ezeoma, and she'll be schooling us on food allergies. It's common among the younger children, especially babies and toddlers, and more in males. That doesn't mean that adults don't have food allergies, but common now. On the flip side, as we grow older, the women tend to have more allergies because of puberty, hormones and other things that come into play. So you need to be your own sensor to know exactly why you have food allergies and the signs and symptoms, which has been very good in elaborating on set today. So now let's go to the diagnosis. What are the most reliable tests to do to say this is food allergy?
Okay. Diagnosis is mainly clinical, and just like you said, you're the major person that will be able to detect or know what the problem is. You know, because when you eat the food and you start having all the symptoms, you don't need anybody to come and tell you, because the doctor is not there with you. Do you understand? So you really need to be very sensitive and be able to know when there is problem after taking any food. So mainly what we do is the elimination diet when such thing happens, in case we are not sure of what the problem is or which one is which of the foods is the cause. So what you do is that first of all, you stop one food or have a journal, food journal. Okay. So be able to write out which food you ate, what reaction you had, and be able to tease them out. And that comes to mothers, especially for nursing mothers that you want to introduce complementary feeds. We always tell them, like from 6 months, you are meant to start complementary feeds, other foods, maybe introduce formula, because the breast milk is not enough to provide everything that the child needs. So you really need to take it gradually. Don't give the child everything. Do it one after the other at a time, so that we're able to know which one is causing the reaction in case the child reacts to any of the food. So first of all, we do those elimination diets. Then other ones, supportive investigations we can do is we do a blood test. We check for the antibody, you know, maybe IgE. IgE is the most common antibody that is involved in allergy. So maybe you see that there is rising tide of IgE, but not that you come and check that you have increased IgE and you don't have the symptoms.
Exactly.
If you don't have the symptoms and you now come and do and the IgE is high, that means it's not food allergy. So both of them must go together. Do you understand? The another one also, we do skin prick test. So we have to inject some allergen, or maybe food allergen, that things, those are the things you react to. There's a way it's being produced, put it out, you know, inject it, do a skin prick test. And if you have body swelling, rashes, hives, and everything, that's, you know that you're also sensitive to this, and we are reacting to this, so you have to stop.
Okay, so now you've talked about the diagnosis. I'm sure everyone will listen and want to know how to prevent this, apart from probably just say stop eating that food that you have recognized. So what happens if an individual continues to take that which he or she reacts to?
It's not stubbornness. When we do it, something, taking something.
Yes, I think
I know I'm allergic.
I'm allergic. I'll just take a little.
And some people like, just like you say, treats. It's those things that you even like that you will not
like chocolate, like
exactly
your favorite.
react. So the best thing, actually, the best is just to avoid. That's the best thing, is to avoid the food. Then, first of all, what even happens when you even have the allergic reaction? So that's treatment. We'll now come down to that. So you also give antihistamine, you give steroids, penicillin, just like you told us. Then we'll do mast cell stabilizers. We give mast cell stabilizers. You know, it's from the mast cell that the histamines are being released, and once it gets degranulated, the histamine is released. And histamine is the major thing that causes all this. So we need to get something that will have to stabilize that mast cell, so it won't be degranulating and be causing all the reactions. They will do immunotherapy. In immunotherapy, we must have to do it under the watch of a doctor. So what we are doing now is that, just like what you said, you give them a high dose of those food, just be introducing the food. It gets to the point that the body gets so used to it that it will not cause any reaction. But it's something you have to really do under the watch of a physician. But it's always better, the best thing is to avoid, prevent it. Don't allow it, just stop. You can find an alternative to that.
So do people have to carry EpiPen? Those that have food allergies?
It's not what you just carry yourself. It's a drug that a doctor must give. You must be under the watch of the. But the basic thing you can carry, you can take your antihistamines, levocetirizine, loratadine. All those ones can also help. That's why you can. It's out of counter drugs, so you can get those ones.
What are the possible complications that will arise?
Wow.
If it's
that was
severe,
so...
if it's so severe, it's death. That's the most common complications, because if it's life-threatening and you don't have anybody around, of course the person will die. So it's really as serious as that.
Wow.
So it's better to avoid.
So how do you prevent it? Especially, cross-contamination, home, restaurant, travels.
So another thing is that very important thing is that when you're traveling or when you want to buy you want to get a food, always read the label so you know what is being the ingredients they use in making the food. It's very, very important. And know if there's any of those things that you react to that is there. And when you're traveling, always tell them, you know, when you're buying your tickets, there's a space they will ask you for allergies and everything. So you also write it, because I of course, most of the time when I'm on board, they were asking you, are you allergic? They will even get your own special food, so that your own food should be special and, you know, well made.
Okay, so for those that don't travel all the time, usually around the UK, how, because I know that they go to supermarkets to buy stuff. How would they now know what they should do?
Yeah, especially in those tiny prints.
Yes.
You know,
If you're not sure of what you're getting, it's better, don't buy. I think that's the best thing. If you're not sure, don't buy. It saves you a lot. Yeah.
But is there a difference between allergy friendly from free from? You know, because there are some things, but just labels, they say allergy friendly, and then some will say free from. Is there a difference in that?
No, the thing is that, you know, they know the common things that can cause allergy. So they will have processed, and they're the ones that produce the food. So they will know which one that is, the allergens are not there. So that's when they say it's free from all these common allergies are there. Yes, yeah.
Please, your last word to our viewers out there, because for me, I think this is so, it's a bit personal, because I've had cases, even on board, you know, when they start calling any physician on board, and it was really, really bad, because these were a young couple that were going for honeymoon. So please, for our viewers, it's be nice for them to hear what are those punchy, you know, take home that they should know about food allergies, and not just assume that I like it, let me continue taking it. No, exactly. So, especially parents and schools too, because teachers, that they may be the ones that even know that the child is allergic before the parent gets to know.
So please, take home message is that self-control is very important. It's not everything that you like, that you know that is dangerous for you, that you take. So please, let's be mindful and be our own guide. You don't need anybody to come and direct you all the time. So let's be have enough self-control and be able to know what to take and know what not to take. It's very important.
Thank you so much, Doctor. I'm sure when we call you next, you'll come, you know, helping us to demystify some of all those things, and of course, show your pretty face to all our viewers, because we want to say, where's that Dr. Ifeoma Ezeoma? Thank you so much for coming on board. To our viewers out there, you've heard it all. Self-control is very important. If you're allergic to any certain kind of food, don't use stubbornness to continue taking that food. It's not good for you. Find alternatives, find other ways to, you know, still eat what you like, but this you are allergic to because your body is reacting to it. And you heard all the signs and symptoms that we present. It could be life-threatening. When we asked her, what's the worst case scenario, she didn't even blink. She said, death. So please, food allergies is real and it's affecting people out there. Don't be a part of the statistics. Until next time, my name is Dr. Memona of Kadri.
Dr. Ezeoma, thank you so much for coming on our program.
Always a pleasure.
See you again.
Thank you.
So our viewers, just want to say thank you for keeping a date with us again on The Physicians. And till next time, next week, ensure you call somebody to always watch with you. My name is Dr. Martina Agbere. Stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.